Chapter 24 deals with infections with the digestive system. So this is a long one because there's a lot of them. Gastrointestinal diseases. Typically, the symptoms you're going to have are diarrhea, vomiting, probably abdominal cramps. Severe intestinal distress is the way a professor of mine used to call it. Sometimes they will make a distinction between infection versus intoxication. Infection is when it's the microorganism. You have to have that ingested. It has to be inside you, and it's the organism that's causing the problem. Intoxication, and this may sound picky, but essentially what we're talking about here is the microorganism, let's say a bacteria, is producing a toxin, and it's actually the toxin that's making you sick. And when we're talking about digestive system diseases, the reason we make this distinction is that sometimes if it's the toxin that's making you sick, you may not actually have to ingest the bacteria. So the bacteria may never enter you. It's maybe the bacteria was present in a food item and it produced the toxin, you ate the food, and it's the toxin that's making you sick. So yes, we do make those distinctions sometimes. You're also going to find that a very common theme is, how is it transmitted? By contaminated water and food. You're ingesting that contaminated food. So you start to see, and you've already seen it somewhere, if you can have a clean water supply and clean food, that is going to do wonders in terms of prevention of the diseases. And that is one of the reasons why with any type of a natural disaster, in this area, say with hurricanes, etc., any type of, when there's political conflicts and wars or anything like that, one of the first things that we're always pushing for is to get clean water into the area for the people to consume. Because you're trying to clean up from the natural disaster, or you're trying to deal with whatever situation is going on there, the last thing you need to do is now to have a whole bunch of people getting sick. And the way to prevent that is to have clean water, clean food also. One of the most common ones that you hear about, or more frequent ones you hear about, is with E. coli. And this is just showing in this picture. I included it from the book because it's kind of a neat little picture, I thought. Over here it is, you can see all the cells are kind of a coccybacillus shape, and on the left here, and then over here you can see where there's a lot of extracellular matrix, all these little fibers in here that help to kind of stick it to surfaces. It helps to form a biofilm. Anytime a biofilm is formed, that's going to make it even harder to treat and deal with. With the digestive system, just once again, brief anatomy of it. You've got your oral cavity, and of course I'm mentioning here the teeth, the tongue, and the gums, because we do see infections like on the teeth. You see infections on the gums. The pharynx, the esophagus, the stomach, small intestines, large intestines, rectum, and anus. And then you have all your accessory organs, like your salivary glands, you've got your liver, you've got your gallbladder, your pancreas, the spleen. So obviously with the mouth, you're going to have potential for entrance because of anything you eat or drink. One thing to keep in mind is with the stomach, this environment in the stomach is considered to be very harsh because of all the gastric juices, etc. It has a pH of about 2. That's very, very acidic. And so you may not realize it, but a lot of things that you ingest may have microorganisms, but they never make it past the stomach. The acid's going to kill them. When you have organisms that infect the intestines, yes, those were able to get past the stomach. Sometimes it was maybe just the sheer numbers. Yeah, maybe most of them were killed in the stomach. But but as long as a few of them were able to get past, okay, now you're going to be sick. There are microorganisms that exist normally throughout the digestive system. Depending on the location of where you are, that normal microbiota changes. In other words, you have bacteria, viruses, in your mouth. There are some that are obviously normally there. They're part of that normal resident environment. However, if you look at which ones are present in your mouth, it's not going to be the same ones that are present in your large intestines. It's a different environment. There's going to be a different community there. In terms of, okay, what is the normal community that's there? You do have some archaeas, you have some bacteria, you have some fungi, you do have some protists, you do have viruses. They're all keeping each other in a proper balance. So once again, if there's anything that gets these out of balance, that's also increasing the risk for somebody else that's got out of balance, and somebody's going to take advantage of that. With the oral cavity, you do have saliva from the salivary glands has lysozyme in it. That has antimicrobial properties, as you know by now. That's going to help kind of keep things in check. Chewing, when you are eating and you're chewing and you're mixing that saliva with the food, you're also mixing it with any microorganisms that aren't normally there, that may have entered on the food, is going to kill them. And it prevents them from becoming established. Just even the rinsing of the saliva, that liquid movement, it's kind of adverse to being able to set up shop someplace when you constantly have fluid moving over you. So as soon as you start eating and you're moving that food around in your mouth, digestion starts. So you're mixing that saliva, as I said, with the food, and so the killing, if you will, if there's food or microorganisms in your food, that saliva becomes exposed to it immediately, and it starts the process of it. Salivary glands, you've got the sublingual glands, which are here under the tongue. You have the submandibular salivary glands right here, and the largest one is the parotid glands over here. With looking at the GI tract, gastrointestinal tract, and the microorganisms are there, as I just said, the acidity of that stomach is going to prevent most things from growing there. The small intestines will support some microorganisms. Small intestines is where most of the nutrient absorption occurs. So obviously there's a lot of nutrients there. We're trying to absorb it for us, but it also is a good environment for the microorganisms. In terms of the resident normal ones, there's lactobacilli, diphtheroids, and candida there. The large intestines will have more microorganisms there. They have a wide, diverse group that's naturally there. They actually help with some of the final breakdown. As the final waste products are moving through, the microorganisms are able to utilize some of that for nutrients for themselves, and some of their byproducts actually are beneficial for us. They're producing vitamins, certain vitamins like vitamin K for us. So we need to have them. If you're thinking, oh, I don't really want microorganisms in my intestines, we need to have them. In some areas of the digestive system, the mucus production helps to prevent pathogens from being able to become established in there. In the small intestines, you have what's known as Peyer's patches. This has concentrations of some of the cells associated with our immune system that help detect those pathogens. So that if you think about it, food moving through the intestines, if it's able to penetrate through the intestinal wall. Now it's into the body. That's going to be harder to treat. So the Peyer's patches, you increase the like the antigen presenting cells, your macrophages and stuff, have a higher concentration of those near the entrance points. Well, the intestines is an entrance point, and so that's why we have the Peyer's patches there. They're helping to prevent infection. When you eat and the food items pass from the mouth down the esophagus into the stomach, it gets churned up and broken, and then it's slowly released into the small intestines, and it continues to move to the large intestines. It's constantly moving, and that constant motion also helps to prevent infection. Just keep it moving. If you have your resident normal microorganisms there, they're already taking up the niche, they're already using nutrients there for themselves, they tend to outcompete any newcomer coming in. It's called competitive exclusion. If I've already set up shop here, there's no room for you. So just keep on moving. This is showing from the intestinal standpoint, these are goblet cells where you have these large circles. They're the ones that are producing the mucus. And so that, like I said, helps to move things along. Some of the terminology now. Periodontal disease refers to inflammation and degradation or erosion of the gums. Ulcer is an open sore. Gastritis is inflammation of the stomach lining. Enteritis is inflammation of the intestines. Gastroenteritis refers to both the stomach and the intestines being inflamed. Hepatitis is inflammation of the liver. Colitis is inflammation of the colon, which is referring to the large intestines. And dysentery, this is a disease where you have excess mucus production. You end up with very watery stools, heavy diarrhea. One of the things you need to really be concerned about if somebody has dysentery is replacement of those fluids, not just replacement of water, but also of the electrolytes. So with a lot of your diseases associated with the GI tract, where diarrhea may be one of the things, you need to be concerned about dehydration of your patient. So we're going to start looking with diseases associated in the oral cavity, in the mouth, and then we'll move on to the GI tract. So with the mouth, some of the bacterial infections. We see Streptococcus mutans. This is a gram-positive. It's a causative agent of technically what's called dental caries, which is cavities. What happens is it tends to form a biofilm on the teeth. And by now you know that if a biofilm is formed, it's harder to treat that. So what happens, it does form a biofilm, and then it starts producing acid. The acid is able to dissolve some of the minerals on the surface of the teeth with the enamel. That's protecting the teeth. You start breaking down that enamel, and it leads ultimately to cavities. The biofilm, another problem that you have besides the cavities is that it starts to calcify and it forms tartar or plaque. And then you've got to be able to clean that off. Tooth decay is going to occur in stages. It doesn't occur overnight. It does occur in stages. How do you treat it? Well, if you have regular dental cleanings and you use oral antiseptics, that's going to help prevent it from ever happening. And now, just prevention is good hygiene, good prophylactic treatment, which is going to mean brush your teeth, floss, make good practices. This up here in the upper left, you can see where there is a cavity, the black area. You can also see on the surface right here, you've got several problems going on right here. Now, what happens is, like I said, it occurs in stages. Here's your tooth. And here's part of our problem, obviously. You start to have a biofilm formed initially on the surface of the tooth, and you get plaque starts to form now over here. So now you've got a problem occurring here. The cavity, you're breaking down the bacteria with that biofilm. It's breaking down the enamel. You're forming a cavity. The cavity just keeps breaking down, dissolving the minerals. Now here's the problem over here. You now have reached into the root of the tooth. That's where the blood supply is. You're here in the pulp cavity. You have blood vessels here. This now, you're forming an abscess down here at the very tip of the root. So that's going to have to be treated here. So now you have to clean up this infection here. The concern is blood vessels here. Did the bacteria enter the bloodstream? And that's what I always say. Now where is it? So you're treating an abscess here. You need to treat the cavity here. You've got the plaque, which is leading to tartar buildup here, which is going to start to erode the gum line right here. It's going to start receding. You've got a problem there. And then, yes, where did the microorganism go? Where is it now? Is it systemic? So don't wait for the last stage. Start treating in the very beginning, or prevent it from happening in the first place. It's just another series of pictures here. You can see the tartar buildup here in A. You're starting to see decay right in the middle there in that dark area. On this X-ray, you can see where the arrows are pointing to the darker areas. That is showing infection. Obviously, you've got a severe cavity here, which has then progressed extremely severe over here. So you have all these different stages of it. If you keep up with brushing your teeth, flossing, and keep up with your dental appointments, prevent all of this from happening. Periodontal disease, there are a couple of organisms that can cause this. And what are we talking about? Inflammation of the gum, and then also the gum starts to recess. I mean, it starts to pull back and recede, move down. It's not covering as much of the tooth as it should be, which is going to lead to additional infections. You can prevent this by having good dental hygiene. What are the microorganisms that can cause this? Porphyromonas, which is gram-negative, Streptococcus, and Actinomyces, which are both gram-positive. So you can start by treating with good dental hygiene and dental cleanings to help prevent this. And if it starts to happen, it's a way of treating it. In severe cases, you may need antibiotics. So once again, you can see the tartar and the plaque build up here. But they can, when you go for your dental checkups, if you have a problem with periodontal disease, one clue is when you have kind of reddening along the gums over here. This is an indication, this reddening. They will measure, often for each tooth, to see, like, if the gum was originally here, the gum line, how much is it receded? And they will measure it. You've got some recession going on right here because you normally don't have this point like that. And so they will measure. That way, number one, they can see from one visit to another, is it getting worse or not? In severe cases, if this gum line, let's say on here, if it has receded way back, they actually can do surgery, periodontal surgery in extreme cases, where what they do is they will take a strip of tissue, typically from the roof of your mouth, and then place it over here where it has receded. It's kind of like a transplant, I guess you would say, of the gum line. Just keep regular cleanings of your teeth. So this is showing the healthy gum line. Notice how high up it is, right up here. Gingivitis, inflammation of the gum. That's the first sign right here. Here's your gum line. It's starting to turn red. It's not a nice pink, it's a red. Notice the difference right here. This is where the gum line was. Look at the recession you have. And then it's continued. Now, it used to be up here. Look at how much of it has eroded away and recessed or pulled back. And now, number one, how's that affecting holding the tooth in? Number two, you're exposing this whole area of the tooth. And as you can see, it's starting to degrade. You're getting cavities here now. You're getting closer now, and in this case, now you have infected into the pulp cavity. So you've got an infection now on the inside, and it is going and traveling down. So once again, now you have multiple problems in here. Trench mouth. This is caused by a couple of different bacteria. It's very acute gingivitis. You often have ulcers forming and tissue dying. This is usually seen here in the U.S. with immunocompromised individuals. It's not commonly seen, thank goodness. The bacteria that are responsible for this, Prevotella intermedius, gram-negative, all of these are gram-negative. Fusobacterium species and Treponema vincenti. You can treat this by cleaning and by administering antibiotics. So as I said, this is where you have very extreme. Look at the recession that's occurring with these teeth, how red the gums are. You don't want that to progress even further. In terms of fungal infections with the mouth, Candida albicans, it's a causative agent of thrush. It's part of the normal microbial community there, but when things get out of whack, and you get an overgrowth of it. And it's like, woohoo, let me take over here. This is more common in children and also your immunocompromised individuals. It can be treated with antifungal drugs. You want to treat it, even though it's a normal one of the community, you need to basically kill the excess ones. And this is what it looks like. You get these white patches that you see in the mouth here. In terms of viruses with the mouth, you have herpes simplex virus type 1, HSV1. It's double-stranded DNA. It can cause oral herpes as well as herpetic gingivitis. It's going to be transmitted by the saliva, transmitted from one person to another, or contact with open lesions. Usually it's self-limiting. You can treat it with antiviral drugs. So you can see you have cold sores here on the lips. It could be transmitted further, and then here you can see signs of the open sores and lesions on the back of the throat, the opening to the pharynx. Another viral infection associated with the mouth and the oral cavity is the mumps virus. It's a single-stranded RNA. The mumps virus infects the parotid salivary gland. That is the larger one of the salivary glands that tends to be located kind of in front of the ear. It is highly, highly contagious. It's transmitted by droplets or exposure to contaminated saliva. This used to also be one of your childhood diseases. Thankfully, the numbers have decreased dramatically since the 60s when the vaccine was introduced. So there is a vaccine. It's part of the MMR. Measles, mumps, rubella. If someone were to contract mumps, you just treat it mostly with supportive care. Treat the symptoms. So your parotid gland, as I just said, is in front of the ear. It's in this location. So when it gets infected and it swells up, years ago they used to refer to someone who had mumps kind of as having chipmunk cheeks because it would swell up so much. And if a person had mumps, it didn't infect necessarily the parotid gland on both sides. It might, or it might just infect on one side. So now we're moving on to beyond the oral cavity and infection of the GI tract. These are usually foodborne diseases. If we talk about it, remember I said we make the distinction between infection and intoxication. And as I said, dehydration is going to be a major concern. Replace the fluids, replace the electrolytes. In terms of prevention, one big thing is keep your hot foods hot and your cold foods cold, and cook your food. If you cook it, that's going to solve a lot of problems. So sometimes with food, we talk about a danger zone area. You've already seen that cold temperature inhibits the growth of microorganisms. So if you keep things in the freezer or in your fridge, that's going to reduce the chances of contamination occurring. When you cook food, you need to cook it completely. This area is the danger zone, just room temperature areas. Okay, well, okay, room in degrees Celsius, room temperature is typically around 21, 23 degrees C. Keep in mind, if you have cooked hot foods, okay, if you have those hot foods and you bring them, you're having a picnic. You've got everybody over for a picnic, or maybe there's a game and you're all sitting watching the game. Don't leave the food out here for extended periods of time, because it's now in the danger zone. As that food, if it's hot, as it cools off, you're basically setting up the opportunity for microorganisms to grow in it. Did you heat it back up again? If you have cold foods and you've stored them in the fridge and you bring them out at room temperature, remember, refrigeration doesn't kill, it inhibits. That means when you put it at room temperature, some microorganisms that were there previously are like, oh man, she got me out of that cold. Oh, right. Oh, there's food here, there's sugar, and they start to grow. So just be careful of not only food prep, but food storage. And if you have leftovers, how are you keeping them? Did you heat them up again? Are you making it easier for the microorganisms to grow in it? Just be careful. Be aware of what you're doing. So here we go. Staphylococcus aureus. You've seen this before. It's gram-positive. It does cause some food intoxications because it produces a lot of enterotoxins. It's somewhat resistant to lower pH. And this is usually associated with raw or undercooked meats and dairy products. One notorious thing is potato salad. Potato salad that is a mayonnaise-based one. Staphylococcus loves that, especially if you're at a picnic and you take out the potato salad, you set it down, and then 4 hours later somebody comes along. Oh, do you think this should go in the fridge? Well, maybe it shouldn't have been out for 4 hours. It can be out for a little bit. I'm not saying it has to stay in the fridge. I'm saying you take it out, you use it, you put it back in the fridge. With this type of, because it's a toxin, it's considered a food intoxication, it's a type of food poisoning. You're going to be sick. You're going to regret eating that potato salad or undercooked meat. Usually, no treatments required. Just let it run its course. Watch your fluid intake. Shigellosis. This is also called dysentery. It's caused by ingestion of contaminated food or water. You don't need very many bacteria for it to make you sick. There have been studies that have been done. It produces a toxin. It's a toxin that's going to make you sick. Studies have shown you only need, an adult only needs about 10 cells, 10 bacteria to make you sick. By now you guys know that's not very many at all. Okay, so cook your food. Shigella dysentery is the most virulent of these strains. Shigella is a gram-negative bacteria. There are some other species, Shigella flexneri, Shigella bordia, and Shigella sonnei, which all of them can cause shigellosis. You are going to regret big time. This can be very serious. Treat with antibiotics and fluid replacement. This is showing where they did a blood smear, and you can see there's the red blood cells, the white blood cells that are present in here, but then there's also these small here is Shigella. Salmonella enterica. This is gram negative. It causes salmonellosis. Salmonella infections usually are associated with consuming contaminated food, and it's usually associated with poultry, with chicken. It's the number one. Either eating contaminated the chicken meat or eggs. It's also associated with the chicken eggs, which is why they say you shouldn't eat raw eggs. Salmonella is also associated with handling of certain animals. Turtles are notorious for having salmonella on them. So they recommend if you have turtles as pets, if you're handling turtles, wash your hands after you've put them back in whatever environment they're in. Just wash your hands after that. In terms of the contaminated food, cook your food. It's self-limiting. The number of cases we feel are grossly underreported, meaning that there's more than what we know. How do you treat it with hydration? Getting salmonella food poisoning is not a fun experience. I can say this from experience. Unfortunately, when I was in grad school, I did contract it one time. I ate a chicken chimichanga from a particular fast food restaurant, which is not in this area. So it's one none of you in this area of Texas are familiar with. We'll just say, for most of your food poisonings, look back about 8 hours, 8 to 12 hours, and that tells you what the contaminated item was that you ingested. And that was true for me. It was about 8 hours later. Ooh, I was so sick. I lost 4 pounds in 36 hours. So it's not the diet method I would recommend by any means. The reason I'm mentioning, that you have this massive weight loss is you have to make sure you stay hydrated. You may be sick, but just keep trying to push those fluids in. Like I say, it is often associated with poultry on this. So this shows the salmonella, that's the pink cocci here, or excuse me, bacilli structures here that are trying to enter into the epithelial cells of the intestines. Salmonella typhi is, once again, because it's salmonella, is gram-negative. This is a causative agent of typhoid fever. Typhoid fever, you have production of a toxin. It is also transmitted by contaminated food or water. Some people may be asymptomatic with it. Historically, you had Typhoid Mary, who was responsible for a huge outbreak. There is a vaccine that is available. It's not necessarily given to everyone, but if you are traveling to an area where this is prevalent, then you might want to consider seeing if you can get the vaccine to help prevention. If you do contract typhoid fever, you do treat it with antibiotics. E. coli, as you know, it's gram-negative. How is it transmitted? Usually by the ingestion of contaminated water or food. E. coli is an organism that we use. It's what we call an indicator organism for testing for water quality. So when you're testing to see if water is safe to drink in the United States, what are you testing for? You're looking for E. coli. Why? Because E. coli is indicative of recent fecal contamination, because it's normally in the intestines. So if it's in the water, somebody's or something's been basically pooping in the water. So sometimes you can get sick if the water's contaminated and you've consumed that contaminated water. But it can also be in food, and this is notorious to be in hamburger and undercooked hamburger. So some strains produce a toxin, and that's what will make you sick. In terms of hamburger, one way to prevent it is cook the hamburger. The cow does not still need to be mooing. Just cook it. E. coli is what is also associated with what is sometimes referred to as traveler's diarrhea or Montezuma's revenge, because of being in the contaminated water source and people are drinking that. So you end up with dysentery or severe intestinal distress, as we say, colitis, inflammation of the colon, the large intestines. There's different strains of E. coli, depending on the strain. Some of it may be self-limiting. Unfortunately, let it run its course. Just keep those fluids coming in. And sorry, you can have a miserable 24 hours, but it will clear up. In severe cases, you may need to give antibiotics. Vibrio cholera. This is a gram-negative bacteria. It is the causative agent of cholera. It typically is due to poor sanitation or contaminated food or water that's ingested. You can prevent this by having good sanitation, clean water, clean food. One of the problems with Vibrio cholera is that it does produce a toxin, and this toxin causes a very rapid dehydration and electrolyte imbalance. Very severe diarrhea. It's often referred to as rice water stool. And so this certainly is a case of where you need to be replacing the fluids and electrolytes. Just keep replacing those, keep the patient hydrated, and it's self-limiting. One thing about Vibrio cholera, in southeast Texas, southern Louisiana, southern Mississippi, Alabama, along Florida, oftentimes, in terms of the causative agent, it often will infect oysters, and so some people may contract cholera from eating raw oysters. So as I said, it's often associated with, poor sanitation. This is another one you're concerned about with natural disasters. If let's say the sewage treatment facility has been damaged from a hurricane, you want to get that up and running because you want to restore and have proper sanitation methods so that as you're trying to do your cleanup, you're also not dealing with a huge outbreak of illness. Over here on the far right, it does show what the cholera typically kind of has a little bit of a curved, it's bacillus shape or rod shape, but a little bit of a curved shape, so it's often referred to as comma shape. Campylobacter jejuni. This is a gram-negative. It causes gastroenteritis. It's transmitted by the ingestion of contaminated water, contaminated poultry, or unpasteurized milk. It's usually self-limiting. This is one of the major causes of gastroenteritis. So treat with supportive care. Provide those fluids. In extreme cases, you may need to give antibiotics. Helicobacter pylori. This is a gram-negative. This is a causative agent of peptic ulcers or stomach ulcers. It also has been associated with an increased risk of stomach cancer. This bacteria is able to neutralize the stomach acid, and it's going to destroy the stomach lining, and it's slowly forming those ulcers. Some strains, not all of them, but some of them we have found also produce a toxin. How is it contaminated or transmitted? It's transmitted by contaminated saliva, contaminated food, or water. You treat it with antibiotics, but you're usually going to do a combination of 3 antibiotics to try to knock it out. This is showing what happens is right here is the bacteria, and it's able to start breaking down the mucus layer down to the cells, exposing the stomach has a mucus layer to protect its own cells, and the bacteria is able to break down through that. So it's exposing the surface of the cells of the stomach. You get the formation of the ulcer. Clostridium perfringens. Clostridium is a gram-positive bacteria. It is an endospore forming. It is anaerobic, and it can cause gastroenteritis. With Clostridium, because it's an endospore forming, one of your concerns is, if you remember endospores, it's a survival mechanism. They tend to be very resistant to harsh environments. So there's a concern in trying to control it. You're not just controlling the vegetative cell, but you're trying to control and eliminate those endospores too. How do most people get this? It's by ingestion of contaminated food, especially in meat. It does produce a toxin. You can treat this by, once again, fluids and electrolytes, keeping the person hydrated. Now there's a different species of Clostridium, Clostridium difficile. As we just said, still gram-positive. It also produces endospores. It's also anaerobic. This can cause severe colitis. It does also produce a toxin. Part of the problem with Clostridium difficile, which is commonly referred to as C. diff, is due to the overuse of antibiotics. This can be problems in healthcare facilities. It definitely is one of your nosocomial infections. You have an imbalance of the normal microbial community, and here comes C. diff, and it takes advantage of that. So some of your high-risk groups are going to be your immunocompromised people. Someone who's been recently on antibiotics, where the antibiotics may have triggered an imbalance of that normal microbiota. People who are in a long-term healthcare facility and older individuals are also at higher risk. How do you treat this? First thing you're going to do, if the person has been on antibiotics, stop that previous antibiotic that's causing the imbalance. Certainly always provide the supportive care, replace fluids and electrolytes, and then you're going to be starting them on a different antibiotic. Because Clostridium difficile, any of your Clostridiums are anaerobic, chances are you're going to see C. diff. Well, unfortunately, that's just the way it is. Because it's anaerobic, just so you know, anaerobic organisms are notorious for, it's another way of putting it, they stink. They have kind of a unique smell to them, and it's not a pleasant one. So we'll just say you're forewarned. And so what's happening here, once again, in the intestines, they're able to find their niche, and they trigger severe diarrhea. Bacillus cereus. Bacillus is gram-positive. They also are endospore forming. They are aerobic, so they do like to grow with oxygen. They do produce toxins. It's transmitted by the ingestion of contaminated food, sometimes associated with rice and or meat that's been left at room temperature for too long. Usually the symptoms are mild, so you can just use your supportive treatment, supportive care, and rehydration. Yersinia species. Yersinia is gram-negative. It causes gastroenteritis. Excuse me. It's transmitted by the ingestion of contaminated food and water. Are you seeing a common theme here? Yersinia intercalata and Yersinia pseudotuberculosis are two of the species that can cause this gastroenteritis. Excuse me. They do produce toxins, but once again, it's usually mild, usually self-limiting. Young infants are going to be a higher risk. Watch the symptoms there because it can become more severe. Treat with your rehydration, supportive care in those severe cases, give antibiotics. Moving on to our viruses now. Rotaviruses. They're double-stranded RNA. They cause gastroenteritis, one of the main causes of diarrhea. Think rotavirus, Roto-Rooter. It's going to clean you out. Children and elderly are at higher risk. It's often due to poor sanitation and contaminated water sources. There is a vaccine that is available now for this, and you treat by rehydrating the individual. This is what the rotavirus looks like. Noroviruses. These are single-stranded RNA viruses. It also goes by the name of Norwalk viruses. It causes gastroenteritis. Your infants, young children, and elderly will be at higher risk. This is very, very contagious. It is easily transmitted by touching surfaces, direct contact, or consuming contaminated food. This norovirus is the one that always seems to hit cruise ships. When you hear about it, an outbreak and 400 people on a ship being sick, it's probably norovirus, and it's probably due to contaminated food. And then once one person is sick, whoever ate the food is sick. But now, because it's also highly contagious, you're in a confined space. It's just an epidemic waiting to happen. It's usually self-limiting. Treat with replacement of your electrolytes, your water. But if it's highly contagious and you're on a cruise ship, you're kind of stuck. Astroviruses are single-stranded RNA viruses. They also cause gastroenteritis. Once again, infants and children are at higher risk. Once again, it's transmitted by contaminated food and water. And once again, how are you going to treat it? Fluid replacement, electrolyte replacement. Hepatitis. Hepatitis is the inflammation of the liver. Typically, symptoms are going to be jaundice. That's oftentimes one of the first symptoms that you see. And it's a big clue is kind of yellowing of the skin, and because the liver is not processing albumin correctly. Yellowing in the eyes, the white of the eyes is a big one. Nausea, vomiting, joint pain, loss of appetite. There are 5 different types of hepatitis viruses. There are differences in the way they're transmitted. We'll look at the symptoms are different, the severity is different, treatment's different, and whether you end up with a chronic long-term infection is also different depending on which strain you have. They're named as hepatitis A, B, C, D, and E. All of them are single-stranded RNA viruses except for hepatitis B. Hepatitis B is a double-stranded DNA. So, if you are reading older books or papers or something, just sort of FYI, yes, you have hepatitis A, hepatitis B. They named them alphabetically in the order that they were discovered. However, just to kind of FYI, like when I was in school, they didn't call it hepatitis C. I have no idea why. What is known as hepatitis C now, when I was in school, we called it hepatitis non-A, non-B. Why they did that, I have no idea. But if you're reading older papers or, looking up something from years ago, that's how it was called at that time. This was back in the early 80s. So finally, at some point, they got smart. When you discovered hepatitis D and you're going, well, we have hepatitis A, hepatitis B, non-A, non-B. Well, what do we call this 4th one? And finally, somebody got smart and said, why don't we switch non-A, non-B to C and just follow alphabetically, which is what they should have done from the very beginning. So Like I said, I have no idea why they call it non-A, non-B, but they did. But hepatitis B is the only double-stranded DNA. It's the only DNA virus of the hepatitis viruses. And so this is showing just here that you can see the differences in, number one, the structure of how they look. If there's a different structure, that can pretty much tell you there's going to be differences in the way that it's transmitted, etc. Differences maybe in some of the symptoms of it. Like I said, hepatitis is an inflamed liver, and jaundice. You tend to see, notice the kind of yellowish tinge to the skin, and look at the white of the eyes here, how they definitely are yellow. So, hepatitis A. Hepatitis A is transmitted by contaminated food or water. It can also be transmitted person to person. Usually it's mild or even asymptomatic, may not realize you have it. It's self-limiting. There is a vaccine that is available for children and high-risk individuals. Treatment, there's usually none because usually it's a mild infection. Hepatitis B is transmitted by contact with contaminated bodily fluids. So this one is contaminated by sexual contact, needle sticks. Because of needle sticks, it's more associated with IV drug users. The infection can become chronic long-term. It can lead to cirrhosis, which is a disease of the liver. It can lead to liver failure. It is associated with liver cancer. There is a vaccine that is available for infants in high risk. You treat with antiviral drugs and supportive care. Hepatitis C. This is transmitted by contaminated bodily fluids. So once again, IV drug use, sexual contact. Blood transfusion used to be a problem. They try to, obviously there's a lot of tests. If you're going to receive a blood transfusion, there's a lot of tests that are run trying to make sure that that blood supply is clean. So years ago, it used to be potentially transmitted by blood. Most individuals will become chronic carriers. There is no vaccine available for hepatitis C. There are some new antiviral drugs that they are experimenting with that are showing some promise for treatment. Hepatitis D is contaminated or transmitted by coming in contact with contaminated blood. In order to get hepatitis D, you must also be contaminated or infected with hepatitis B. So it's a kind of a combination thing. And having hepatitis D along with B is what increases the risk for potentially liver cancer if you have hepatitis B. Not everyone with hepatitis B also has D. So it's one of those things. If you have hepatitis B, you may just have that. If you have hepatitis D, you also have hepatitis B. The vaccine for hepatitis B does seem to get protection against D. In terms of treatment, the antiviral drugs that we have are not effective. Hepatitis E is transmitted by contaminated food or water or person to person. It is also self-limiting, does not seem to cause chronic infection. Hepatitis E is not common in the United States, but it is common in Asia. There is a vaccine, but the vaccine is available only in China. Treat with supportive care. In severe cases, there are some antiviral drugs you can use. So those are the 5 different types of the hepatitis virus. Protozoan infections. Giardia lamblia. Giardiasis, also known as backpacker's diarrhea or beaver fever. This is transmitted by ingestion of contaminated food or water or from person to person. Sometimes it will contaminate a municipal water supply. The water that's being supplied for a community, you must filter. If you contract Giardia, you can treat it with antimicrobial drugs. This Giardia is what is one of the common problems besides E. coli with contaminated water sources, especially for people who are camping or hiking out in the backcountry and who think, oh, here's this stream, it looks nice and clear, and let me just drink water straight from it. Filter or treat the water first, because you're not going to see the protozoan in it with your naked eye. Cryptosporidiosis is caused by Cryptosporidium parvium or Cryptosporidium homines. This is transmitted by contact with infected animals, ingestion of contaminated food, ingestion of contaminated water, or exposure to contaminated water. Some people, it's when you say exposure to contaminated water, they may contract it, and that, say, a swimming pool has become contaminated. Treat with just resupplying the water, electrolytes, and there are some antimicrobial drugs you can use, because remember we're talking about protozoans here. This is what Cryptosporidium looks like. This is using a fluorescent stain on it, so you're looking at the glowing cells here. Amoeba histicholacia. Amoeba dysentery is what it causes. It's transmitted by ingestion of contaminated food or water. In terms of the infection, some people, it may be just mild. Some people are not going to have any symptoms. Some, it will be very severe. So you got the full range. You may develop a chronic infection. Treat with antimicrobial drugs. Another protozoan infection, Cyclospora caelentensis. This is rare in the U.S., but it's fairly common in tropical and subtropical areas. Once again, it's transmitted by ingestion of contaminated food and water. You can, once again, have a range of symptoms, from being asymptomatic to very severe. Treat with antimicrobial drugs. For some of these, in case you're wondering, like, why do I need to know what this looks like, which you can see right here, if it's rare in the U.S. It's important to understand some of the major diseases. It's important to just learn about and understand diseases that are prevalent in the location of where you are working in that region. A lot of that you'll find basically on the job. But oftentimes, again, why do I have to learn about diseases that may be prevalent in the tropics if I'm not in the tropics? Number one, do you know where you're going to be working 10 years from now? Who knows where you might end up? Number two, with global travel the way it is, people are moving all the time across the globe. Travel, vacations. So you may have somebody, a patient, yeah, you may stay in East Texas for the rest of your life and always work here. But some of your patients that you're treating, maybe they went on a cruise to a tropical island. Maybe they, you had a business trip somewhere. And so they're going to some of these other locales. So just to have, do you have to have extreme knowledge? No, but just kind of a general understanding of some of these diseases. Helminths are worms. These are intestinal parasites. You have several different types. You've got the nematodes, which include roundworms, pinworms, hookworms, and whipworms. You have what are known as the cestoids, which are flat segmented worms. This would include your tapeworms. And then you have your trematodes, which are your flat non-segmented worms, which include your flukes. Ascaris limburdoides. These are a type of nematode. They're roundworms. The eggs, the way it's transmitted is that the eggs are in contaminated food or water, and you consume that. Usually it's asymptomatic and self-limiting. You can treat with antimicrobial drugs. In extreme cases, you can do surgery to remove the worms. So usually what happens, no, you're not ingesting the worm, you ingested the egg, and guess what? In the body, then the egg goes through the whole, germinate, goes through the whole life cycle. And it's, once again, these are extreme cases of the mass of the worms that have been removed from the individuals. So this is an egg. This is a micrograph. The eggs are small, so you don't see them in there. Once again, cook the food, drink clean water. Hookworm, Nectacor americanus or ancylostoma duodenal. This is transmitted by exposure to contaminated soil. Sometimes just walking across, and it can penetrate the skin. Once it penetrates in, then it moves. And that's where you think, well, wait a minute, why are we covering this with the GI tract if it penetrates through the skin from exposure to the contaminated soil? Because once it gets in you, it travels, it gets in the bloodstream, travels to the intestines, and that's where it sets up shop, basically. Treat with antimicrobial drugs. This shows hookworms here. This is sometimes along the skin. You can see kind of the tracks of them where they're moving. Strongyloides stercoralis is a soil nematode. It's transmitted through the skin. Usually it's asymptomatic unless someone's on immunosuppressive drugs. So you're immunocompromised are going to be more at risk here. Treat with antimicrobial drugs again. Enterobius vermicularis is a pinworm. This is one of your most common helminthic infections in the U.S. transmitted by the fecal-oral route. You treat with antimicrobial drugs. This shows right here, you can see the pinworm, and microscopically here are the eggs. Trichuris trichiaria is whipworm. It's transmitted by ingestion from food that's been on the soil. It's contaminated. So it's commonly in the soil, and then it gets on, think of crops that are grown that are close to the soil. So the food gets contaminated, or it's in the soil and then it gets on the hands, etc. Something that some people don't want to think about is when you say, well, if it's in the soil, how does it get on the food and how does it pass through? Because there's, like, once somebody's infected, how did the soil get infected? You have someone who is infected. We're talking about GI, so it's in the intestines. In the crop fields, how many times have you seen porta potties out there? There's very poor sanitation. And so the food item gets contaminated, the hands are contaminated, the hands are picking the food, processing the food, and so other people end up ingesting it. Treat with antimicrobial drugs. So this is the whipworm. You can see how it gets its name. The eggs from it. Somebody here had an extreme case of the whipworm, and it triggered what is known as rectal prolapse, where the rectum has moved outside the body now. Trichinoid spiralis is a nematode. It's transmitted by ingestion of contaminated food or undercooked food. This is often associated with pork. You can treat this with antimicrobial drugs, but you have to start early because the effectiveness in the later stages is not going to work. Most of your helminths are going to go through, like I say, a series of life cycle, and they may start as a cyst, and then you've got the adult worm, you've got the eggs, and different stages. Drugs are effective differently at different stages. Right here you can see the larvae in the sample of meat. Cook your food. Tapeworms. Tapeworm infection is referred to as teniasis. So Taenia solium is with pork. Taenia saginatum is the tapeworm that infects beef. Taenia asiatica is Asian. And then you've got this one, which is Diphyllobrothium latum is fish. All of them are transmitted by ingestion of contaminated meat, whether it's pork, beef, fish, whichever, that's undercooked. If you cook the food, it will kill it, and then you don't get sick. And you hopefully don't see, you don't know what you don't know won't hurt you, right? Cook it, the meat completely, and then you don't get sick on it. If you do contract it, treat with antimicrobial drugs. So here's an adult tapeworm over here. It's going to use this area to stick to the intestinal walls. Echinococcus granulosum is a cestoid, causes hydid disease. It's transmitted by exposure to eggs and feces of infected dogs or other livestock. The way you treat it is with surgery to remove the cyst, or you can treat it with antimicrobial drugs. Liver flukes. We're still under Helminth instructions. Infections. We're still going here. Flukes, they're a trematoid, it's a flatworm. As you can see, there are several different species, actually genera as well, of flukes, depending on what they're infecting. Whether it's aquatic plants, and if you're thinking aquatic plants, things like watercress. This one also is infecting aquatic plants. This one's associated with freshwater fish, snails. It's transmitted by ingestion of the contaminated food. You can treat with antimicrobial drugs. Intestinal flukes. So the previous ones were liver flukes. This is intestinal flukes. This particular species is the causative agent for the Fasciculopsis. It's transmitted once again by ingestion of contaminated, undercooked food. You treat with antimicrobial drugs. Here is a picture showing the liver fluke and what it looks like over here. It will infect the bile ducts, and over here you've got the intestinal fluke. You don't want either one of them. As you have seen through this entire section, how many times have I said transmitted by contaminated food or water? So obviously, what is a key, as I've also mentioned, for prevention is to provide clean water. Think of how many of these diseases we could stop in its tracks if we have clean water. Provide the clean water, you prevent the infections from occurring. If it's in the food that we're talking about, cook your food. I'm not saying burn it, but just cook it. You know, there's a reason why your mom or your grandmother, whoever taught you to cook, excuse me, with whether it's hamburger, whether it's with pork, well, pork is a little different because, or chicken, you know, hopefully you were taught, you know, cook it so it's not still, the juices are not still running red. The blood's still in there and you're seeing it. Cook it more. Cook the food, have clean water, and that will do so much wonders in trying to prevent the transmission and decrease the number of people who are suffering from these diseases. This is also why it's so important. I know some of you may be thinking, you know, we're very, very fortunate here in the United States to have a good food supply and good water supply. But what about in areas where people are just barely, literally staying alive? That's why it's important. It's just, you know, common compassion to get clean water supplies to people. If nothing else, get them clean water supplies. And then go from there. If people do get sick, well, as you can see, so many of these cause, you can kind of jokingly say, oh yeah, severe intestinal distress. Yeah, you can have severe diarrhea. There's a lot of fluid loss. And so one of the main things you have to look at in terms of treatment then, if you can't prevent the disease and it is occurring, make sure that you are rehydrating the patient, replenishing fluids. And like I've said earlier, it's not just water, it's the electrolytes. Because if the electrolytes get out of balance, then the patient's going to have another whole problem. This obviously is a huge area of lots of infections associated with the GI system.